But then finally, I had suddenly an acute abdomen in the middle of the night. So I had to go to the hospital, and I wanted to be the operator. So they will first look under local anesthesia, and it was clear. My whole belly and later showed also lungs and so with full metastases with what we now call germ cell carcinoma. So that's very aggressive. It was really end stage, and then I thought, no chemo, no radiation. So I exclusively treated myself with mistletoe. No, I'm sitting here, it's now 48 years later. So I really was actually sort of my first cancer patient.
Hey gang, today my guest is Dr. Robert Gorder. He earned his medical degree at the University of Amsterdam Medical School in 1973. The same year, he completed specialty training in anthroposophical medicine.
Yeah.
Tongue twister, with an emphasis on oncology. Dr. Gorder was a University of California, San Francisco faculty member from 1986 to 2008, where he earned a PhD from the University of Witten in Germany, where he continues to serve as a faculty member. In the 80s, he was a physician and researcher on AIDS at San Francisco General Hospital and was the medical director of the Department of AIDS Epidemiology and Biostatistics.
Correct.
In 1993, he founded the European Institute for Oncological and Immunological Research. In 2000, he founded the Medical Center Cologne, it's in Germany, dedicated to treatment of cancer using dendritic cell vaccinations and adult mesenchymal stem cells in combination with immune supportive therapies and hyperthermia.
Correct. Local and total body hypothermia.
That's right. Local and total body. So Dr. Gorder has been around a long time. He's seen a lot, and I'm so excited to talk to him. He's brilliant. And we're going to talk about mistletoe. We're going to talk about dendritic cells. We're going to talk about cannabinoids, and we're going to talk about hyperthermia and maybe a lot more. So Dr. Gorder, it's an honor to spend this time with you. Thanks for taking the time to do it.
It's my pleasure also.
So why don't we start with your journey as a physician, because you started out conventionally trained. What happened in your career to send you down sort of the alternate path of healing? Or did you start out that way? I'm assuming.
Yeah, well, it is so that, of course, I studied regular medicine, so Western academic medicine, but already during my clinical rotations, I was very disappointed with especially chemotherapy. I saw patients, in my opinion, dying because of the chemotherapy. So I studied also acupuncture. I'm also a licensed acupuncturist. I studied homeopathy and also applied that as a medical student. And I was looking for more. How can I do it better?
So this was very early on then?
I was still a medical student, actually, or clinical rotations that I saw with my own eyes. And then what happened? In 1977, 1976, I was diagnosed myself with cancer. At that time, also really end-stage cancer. For half a year, I was tired and pain here, pain there. But I loved to work, so I set up restaurants to give cooking classes to patients and the beloved ones, and did and that, so. So, but then finally, I had suddenly an acute abdomen in the middle of the night. So I had to go to the hospital, and I wanted to be the operator. So they will first look under local anesthesia, and it was clear. My whole belly and later showed also lungs and so with full metastases with what we now call germ cell carcinoma. At that time, it was still called teratocarcinoma, and so that's very aggressive. It was really end stage. So my colleague said, "Well, I'm sorry, you take 4-6 weeks, maybe a little vacation, but that is it." And then I thought, no chemo, no radiation. So I exclusively treated myself with mistletoe. I'm sitting here. It's now 48 years later, and so I really was actually sort of my first cancer patient, and I also felt we must do it differently than. I'm not I'm also a regular medical doctor. I'm regularly trained, professor here, professor there. But I felt there is much more to, especially also in cancer, to cancer therapy, which is essentially non-toxic, because Anyway, so we can that a little bit later. But so I treated myself with mistletoe, not really with hypothermia because I was not prepared for that. But yeah, then cancer more and more disappeared. And yeah, now it's like 48 years later, and I'm fine and can assure you without cancer. But it was a very aggressive form of cancer, germ cell carcinoma, poorly differentiated. So it was a matter of counting the days or the weeks. And so therefore I got also interested to search more because then suddenly, of course, as people smelled, the patients smelled it, I got a lot of cancer patients in my practice. And so so more and more I was, and then also yeah, convinced, and then also it was sort of also proven that what I did, especially with the mistletoe, certain things, also vitamin D3, that even if patients were far advanced in the cancer, they still made a big turnaround. But the big thing which happened, that was already when I had my own cancer research institute at the university in Berlin. That was in the 1990s. We also started to research with dendritic cells. And so for dendritic cells, the Nobel Prize of Medicine was awarded in 2011. So we did it in the 90s and the early 2000s and so, and we could develop a way to make dendritic cells because that was already 15 years before described by Steinman, and it was described, but nobody really knew exactly what their function was, and yeah, and how you maybe could make them, create them. So we discovered and we developed that, and we as a university in Göttingen in Germany and Vienna in Austria, and our group, and we developed a way to make from a simple blood draw. We would isolate the monocytes, and the monocytes, about 15% of all your white blood cells in your peripheral bloodstream are monocytes. And so we isolated the monocytes, the sort of halfway stem cells, and we could make from them, once at a time, tens of millions of dendritic cells, and they were very fit and ready to go. And I always like to compare dendritic cells with policemen, because what you can see in the what the function is, they look a little bit like an octopus. They have tens and sometimes hundreds of little tentacles, and at the end of each tentacle, there is amazingly like a little mouse or a machine to take biopsies. And now these dendritic cells, also while you are sitting there, they crawl throughout your body, looking from your brain to your prostate, to your lungs, to your colon, looking for abnormal cells. And once they have found them, a cancerous cell or a cancer cell, then they take a little biopsy of the tumor-specific antigen, and then they go quickly to the next lymph node, and you can compare the lymph node as, let's say, a military base. Because if you are healthy, then your lymph node is also full with natural killer cells. And they are like Marines, so to speak. But the killer cells, they will only kill cells if they are instructed for that. So these dendritic cells, they instruct killer cells, and it's amazing. One dendritic cell can instruct 3,000 to 5,000 killer cells by all giving them a piece of these biopsies. So then they're very well informed, and then within 2 to 5 hours, they leave as a little army. They leave the lymph node, and they also know the direction, and that is still not completely understood. So it's okay. And then they attack each cancer cell, each cell with this specific antigen. And then usually, depends a little bit on the studies you read, but between 24 and 28 hours, that cancer cell is killed. Yeah, so therefore, because even when you're healthy, you don't smoke, don't drink alcohol, and so, you will make several million cancer cells per day. Because of mutations that take place, especially nowadays, we're exposed to a lot of radiation and electromagnetic fields. So we make really per day millions also of cancer cells. You can also find them, also measure them, see them in the bloodstream, but also in tissue. But if your immune system is functioning correctly, then you never get clinical cancer. But we also have almost a little bit of cancer non-stop, and it's part of life, and we know a lot about that. Now also, so therefore, dendritic cells are very powerful, but we can enhance the function. For instance, so what we always do on the day that we give the patient back its own dendritic cells, so autologous tissue, then we also, if possible, we combine it with a fever range total body hypothermia. That means we go 1.5, maximum 2 degrees up in the temperature, and then we leave the patient so alone, and then the immune system, and that's important. The immune system is very much activated, sort of woken up, if it goes through a fever period. It doesn't have to be high fever, but so 1 degree up, then so what you also have when you get the flu or cold, and then you will activate the immune system. And that's also the function. Unfortunately, I notice even colleagues of mine, but also younger medical doctors, they always think fever is the cause of disease. No, but it's the opposite. Fever is, within limits, it is a natural response to trauma, to stress. Yeah, and therefore you have to activate. You can activate the immune system, but just increasing the core body temperature 1 to 1.5 degrees. Yeah, and I also looked at circadian rhythm, but that would be another topic. But so we have very good results, and we have, for instance, example glioblastoma multiforme. That is the most aggressive cancer, brain cancer we know, and there's actually nobody in the world literature alive after 3 years after diagnosis. And we have quite a few now between 12 and 18 years completely cancer-free. Yeah, and so therefore I always like to say we do cancer immune restoration, because, and with one exception, all the people who went to complete remission, they never got the cancer back, also up to 18 years later, because we can restore the immune system. And if you do chemotherapy or radiation, and maybe it's smaller or it disappeared on the scan, but you keep getting follow-ups because usually it comes back half a year later. So, but we have in all the patients who had good response, it never came back, with one exception, and that was a high-powered attorney from New York, and she had breast cancer, actually dying. She could hardly make the flight across the Atlantic, and so her husband had already another girlfriend, already got a baby there, and so. But when she came back and she was actually fine and cured, there was, of course, she found out, and then she got depressed, started drinking, and and then she had a reoccurrence. But otherwise, because we keep in contact with all our patients, and we also have a lot of documentaries, video documentaries, when they start 5 years later, 10 years later, and so on. So we have also good documentation, and I must say, in all humbleness, especially the combination of dendritic cells and the mistletoe and some fever range total body, we have very good results in almost any form of cancer.
So I want to ask you a few questions about, you just said a lot of things, and I know people are very, very curious and have questions, and so I'm going to try to anticipate those questions. So one point you made, I think that's so important, is that the fever, a fever is a healing response in the body. This is your
natural response.
Natural response. This is your body's way of fighting infection and fighting chronic disease, fighting cancer cells. And so with hyperthermia, you said you're only raising their core body temperature 1 to 2 degrees, correct?
Yeah, 1.5 degrees. So, yeah.
And how was that achieved? What equipment do you use to facilitate that?
As you can see, it's also of course have a website, and they can, but also in video documentaries that also some patients they're interviewed while they undergo the total body hypothermia, and that is, we do that, we increase the core body temperature with infrared. So patients lay in a tent, but the head is free, and then Yeah, and then the temp, and now the infrared, the the
So it's
blood.
like an infrared sauna type
Yeah, like
situation.
an infrared sauna. But in a sauna, the way you do it, then you start sweating and your body is a little bit resisting, and therefore you do not really, in a regular sauna, infrared sauna, you can increase the core body temperature high enough to also have this kind of effect. So therefore, especially in Germany, they make them these beds, and yeah, there's no risk. It's infrared, but you could say it is a little bit in the direction of, yeah, of also infrared sauna, but it works so that within 2 hours, usually the core body temperature has been increased 1.5 to 2 degrees. Yeah, and then we say, okay, that's enough.
Do the patients not sweat while they're
No, they
doing
sweat.
while they're
No, they
doing?
sweat. They sweat. So
Okay.
that's why each patient has a nerve there, and so and the forehead, and so yeah. But they sweat. So afterwards, we're done, and the temperature came more or less back to the normal stage. Then they also shower and they have green tea or whatever they want, so and so, and then they get the injection with dendritic cells. And dendritic cells, they're extremely well tolerated. You see sometimes a few hours after the vaccination that a patient might have a few hours a little bit flu-like symptoms. And that's a sign. We're always very happy with that because the immune system wants more response. So when patients know that, usually, or they go then to a hotel, an apartment, or they're back home, and then we always call them later in the evening, how you doing, and so. But we always know, yeah, I'm fine. But this, some say, yeah, I have a little bit still flu-like symptoms. I didn't take my dessert, so, but otherwise I'm fine. And they knew then the chances that they have full response increases. Yeah?
You're inducing a fever with hyperthermia, and then you're giving patients dendritic cells, which can also induce a fever. And is the dendritic cell therapy, are these their own cells that have been
Yeah,
cultured?
yeah. So we take
Explain
from
that
the
process.
patient, from the arm, from the patient, we take so 5 tablespoons of blood, 6 tablespoons of blood. We isolate from the patient's blood the monocytes, and then it takes a week. We can so a little bit mimic what otherwise it takes place in the organism, and then after a week we have that's only a little amount, slightly milky because they're only white cells. We have then between 10 and 25 million of these dendritic cells, and they are then given back in part in the skin and part intravenously, and so once in a while we do that for certain reasons.
Are
And
B cells technically dendritic cells?
say it again.
Are B cells?
No, no, that's right. Dendritic
And
cells are part for T cells, and T stands for thymus dependent. So all of
yeah.
these cells they have to be for a while also in a thymus to ripen, to mature. Now
So
we
you could
all
also call them T, when people say T cells, those are dendritic
yeah,
cells.
yeah,
Yeah.
and then
Okay.
also
Interchangeable term.
we have local hypothermia.
Yes.
We have also helped to develop that. So that in 1998 or so, we treated our first patient with local hypothermia, and that was developed by Siemens. Well, it's a well-known. We helped them. There's now a third generation of this equipment, and what happens there, that's almost too nice to be true. A patient we build straight through the patient, through an organ, whether metastases or whether it's cancer, and we build up like an high frequency uh, field. So it would say it's not like an microwave, but a little bit in that direction. But it's completely safe. Nobody has to disappear. It takes an hour per session, and and then what happens is it gets straight through you. Also, nowhere healthy tissue is not affected, but cancer cells they always also have abnormal metabolism and abnormal proteins, and which you can use then also as a tumor marker. What everybody knows is PSA by men with prostate cancer, and if you have more abnormal cells, then the PSA increases. But it's never zero. Why? All the tumor markers are never zero because we always make cancer cells. But that should be in control and recognized right away with dendritic cells. But we can then, I had patients I'll never forget, once was an end-stage breast cancer patient. She was in a wheelchair, but she had 2 crutches, and she could maybe walk 10 yards or so, but that was a lot of pain and effort. We treated her first time, also for bone metastases and in the brain and effort, so a couple of hours, different locations. And then what happened, I wasn't there when she dressed up again, but she forgot her crutches. Yeah, because she had so much improvement, less pain, that she used the wheelchair, but she forgot the crutches. Yeah, so and then when she was in the hotel, she called, said, "Oh, I forgot my crutches," but she already felt I'm doing better. Just after one session, it was a local hypothermia, because what happens? The cancer cells always have a higher resistance in these fields, and then you get friction. Yeah, but it's so specific that when you have brain cancer, primary brain cancer, or metastases in your brain, your brain cells are not affected at all. But the cancer cell is quickly increased within half an hour to Celsius in Fahrenheit, so 106 or so. And then cancer cells always have an abnormal metabolism, so they make very rapidly lactic acid. And after about half an hour, there's so much accumulation in exclusively cancer cells with lactic acid that the pH goes very much down, and the cancer cell sort of suffocates in its own lactic acid production. And that's all.
Are you saying that this is the result of the localized hyperthermia, that it's causing the way a cancer cell reacts to it is by producing a lot of excess lactic acid, that it ends up sort of choking on, suffocating it?
Yeah, so that's correct. So they die, these cells, because not all of them at once, but many die because during the treatment. That's why with this patient with breast cancer, because bone metastases are also so painful because of cancer cells which are in the periosteum. So and suddenly you have 30% less. She felt much better and forgot than her crutches and so. And so we have many patients who rapidly, after a couple of sessions of this local hypothermia, developed. We helped them, but Siemens, I don't want to make an advertisement, of course, but Siemens is the only company really, and I'm working with a company in China, but to have developed that, and that you have a direct response, and it is not radiation, so that's important. So nobody has to disappear, and it is very effective. So I highly recommend also colleagues and so to do that. But yeah, in the United States, it is then not approved or this or that, but it is so absolutely safe. And there are also studies, several universities also, like ours, does that in Germany, but then also what they do, if you combine local hypothermia with chemotherapy, then you have to give much less chemotherapy because already the cancer cells are halfway died because of the local hypothermia, and then still chemotherapy on top of it, of these synthetic antibodies. That is done. So then you have to give less chemotherapy and you have this less toxicity.
That's really fascinating. And so Siemens has this local hypothermia device that you were talking about. It's like radiation, but it does not burn you. It does not use that much high-powered radioactive ionizing radiation. It's more using an electromagnetic frequency or infrared, sort of in that spectrum, that's creating local targeted heat, like around a tumor, right?
Exactly, and that is normal. It is absolutely safe. The only risk of what we don't do is somebody has a pacemaker. Because a pacemaker, if you put also an electromagnetic field in the body, the pacemaker might go off, starts running or so. So that's the only contraindication. So we never that it happens then once every other year. So, but then we have other methods. But so therefore I say it is a very also in my clinic we have so like 7 of these apparatus and they run parallel and we can treat many patients and they maybe sometimes 2 locations. So one treatment takes 1 hour, but if you have brain metastases and your liver and so, and it takes 2 hours. Yeah, and then you get up and have a cup of tea or this and that, and they go home until 2 days later, and we treat them once more.
I'd like to revisit your story. So how old were you when you were diagnosed? Were you in your late 20s?
No, I was 26.
Same age as me.
Yeah.
I was 26. And how did you, I know mistletoe has been around for a very long time in Germany. Was it pretty well known even at that time? How did you discover it?
Yeah, because I also did my anthroposophical medical education training, clinical training. I did it in Basel, in Switzerland. Also, and there is also a hospital specialized in oncology, and there was also a mistletoe was given to all the patients. And so I knew about mistletoe. And when it happened to me, I said, I only want mistletoe. And
Yeah.
no chemo, no radiation, and so and I knew I have much better chances if I don't harm my body. Yeah, but only because this is so. Each oncologist, also when they give chemo and this and that, they will always agree that the cause of cancer is always rooted in a malfunctioning immune system.
That's another big point that you made. Yeah, that you made earlier, which is that chemotherapy, radiation, and surgery, those treatments will certainly eliminate cancers for some period of time, sometimes permanently, but rarely it's just temporary because they're not restoring the patient's immune system. And the strong immune system is the key to healing and to staying tumor free.
Yeah, and then you get with chemo radiation collateral damage. So,
yes.
And you often see that the treatment, the standard treatment by itself, causes cancer again, but maybe not the next day, might be half a year to 3-4 years down the road. And we have had many patients who had breast cancer, were operated, then radiation, that's always the standard, and then 2-3 years later, they had lung cancer in that area where they had the radiation. Yeah, so therefore, but why? If we can say we have so many good results without chemotherapy, but let me say one more thing: 96% of all our patients were hospice patients. They came to us when they had no options anymore. I wish people would come more, and I'm glad we can talk that people also maybe should or have cancer. I should first start natural therapies, especially this, and the dendritic cells for which a Nobel Prize was given. Now, that doesn't mean something you do in your kitchen table. And but 96% of all our patients, they came to us because, they told that's it. Yeah, we can give you some pain medication. So, but essentially now that's it. You have to say goodbye. And and then often the family members start searching, especially then also. No, it's not 40 years ago. That time also it was less known, but still it's remarkable that dendritic cells are still not used in the United States. Yeah, but I know why, but I'm not sure. Otherwise, you have to take this out. But it is so. It is patient's own cells which only change it to dendritic cells, and there's nothing you can patent. So it is not. You cannot make big money out of making dendritic cells. You can't patent it, and therefore, I'm sorry to say, you can't make money. And so that is important. And also the other thing with chemotherapy, look in your own history books. So hypothermia, so Professor Coley, he invented that, or he noticed that.
William Coley.
But till the end of the Second World War, hypothermia also in the United States was still, maybe not the only, but a common treatment. And then, after the Second World War, they had these huge stockpiles of mustard gas. That was a toxic gas where you could, whole villages, whole cities, you could kill people there with gas. There's only a risk with the gas that if the wind changed, you might shoot in your own foot. But so the first 8 chemotherapy agents were all made from mustard gas. So they had another purpose to still get rid of the mustard gas. So it must enter the chemotherapy. If you see that, it is all linked because what do we do with the mustard gas? And then they found another way to use it. All first 7 or maybe first 8 were all made out of mustard gas.
One of those is mustargen.
Yeah.
Yeah. So something else you said that you wanted to comment on was we already kind of talked about the problems with chemotherapy and the fact that and radiation causing cancer down the road, and also being short-term solutions. And it's fascinating to me, dendritic cell therapy, that you're basically amplifying a patient's number of T cells that are cancer scavengers, and then putting them back in their body so they can circulate and find cancer cells, and then train that patient's own immune cells, activate their natural killer cells to go out and find the cancer cells and kill them.
And I'd like to use the word restoration. What we do immune restoration. And now the internet thing, as two people in Germany got a PhD with me for studies we did, that we could prove. But what we did, we tested when patients came to us with active cancer, the natural killer cell activity, not the number, but how active are they. Now, and I must say, 99% of all the patients with active cancer had a fairly low natural killer cell activity. And what we could show, that more than 80% had a complete restored natural killer cell function after 8 weeks of mistletoe. So we know now mistletoe has many components. Some of them are already proven in the 1970s at different universities, all the benefits of mistletoe.
What is mistletoe doing in the body?
Now, the mistletoe, Rudolf Steiner came with that as an anti-cancer medication. And what it does, it has several functions. But if I also published a lot on that. But if you can say in a shortcut, mistletoe improves, first of all, the cellular immunity. So it improves also the function of your present dendritic cells. But it's as if dendritic cells allow cancer cells to maybe, or they don't notice, I always say to patients, because dendritic cells need a pair of reading glasses. They can able to see well. So that's all we can make a whole new generation of dendritic cells or policemen. So, but also, you see, and we didn't talk about that yet, but it's all the current vaccinations with messenger RNA, that you see that here, if I have one cell, and that cell must divide and become two cells, mitosis, then the cell, the daughter cell, must be identical. So the mother cell, everything has 46 chromosomes, each chromosome tens of thousands of genes, each gene is millions of DNA molecules, and that can take place within 2-3 hours. So it's amazing, and therefore also once in a while a little mistake is made. A wrong amino acid is built in. Yeah, and that is already a mutation. Now, if it happens once in the cell, it's probably okay. But mutations take place always in the copying process. Yeah? And now, is it so? We have for a DNA repair mechanism. So we have in the cell can of each cell also a mechanism to recognize if there's a wrong amino acid built in. And right away that is recognized and then taken out and replaced by the correct amino acid. So ideally we have a complete copy of the original cell. Now, and that is always special nowadays with all the radiation we're exposed to, electromagnetic fields, 5G and so on, that you see also there is a decreased DNA repair mechanism. And also lectured on that at the university, also San Francisco. And now the mistletoe repairs the DNA repair. So if you take probably 8 to 12 weeks, you have already, you can see that also in laboratory, a significantly improved DNA repair mechanism. So because also cancer cells can divide, but then still it is then recognized. But first of all, in healthy cells, but when you make millions of cells per day and more and more mistakes made, then you get more and more mutations, which will lead to the formation of cancer cells. So mistletoe is a wonder medication and it's completely non-toxic. I've never ever seen somebody, if it is made in the right way, so it is an injectable, and you have to inject yourself. Patients do that usually, what a diabetic patient does 2 times a day. They do 2 times a week, and preferably in the morning, because circadian rhythm and so on. So I only had one patient, was 86, she lives in Rotterdam, and she could not really get a fine needle in the ampule, and then her neighbor did that or so. So it is never an issue, and I've never seen any side effects or things like that. So I'd say it's a miracle medication.
So it could be summed up by saying that mistletoe, it's not killing cancer cells directly, but it is improving and enhancing the function of your immune cells that are critical in identifying and eliminating cancer cells.
And then killing the natural killer cells. But it's not completely true, because there are three groups of glycoproteins. That means a sugar protein connects, three of them, but they're very large molecules and so on. But there are also physicotoxins, and these physicotoxins are much smaller, a whole different group, which are part of the mistletoe, and they can directly also kill cancer cells. So, but the main effect is that we restore immune function.
So you mentioned that 86% of the patients that come to you are coming after, they're coming to you as a last resort.
Yeah.
And this 96.
is 96.
Oh, 96, excuse me. So that's almost everybody. And this is not a surprise to me. We see this all the time, is that patients, they do everything the doctor tells them to do.
Yeah.
And they have a false hope that they will be cured. And after all the surgeries and chemo treatments and radiation therapy and all the drugs, eventually they're told there's nothing more we can do for you, go home and die. And that's when they start looking into, quote, alternative treatment, right? Holistic therapies, nutrition, and they're inquiring about going to Mexico or Germany or somewhere. And this is unfortunate, and it's very common. And I think a lot of these holistic and natural practitioners, integrated practitioners, and clinics get a bad rap because so many patients come to them when they are on death's door.
Yeah.
And so, and again, this is most of the patients that come to you. They're at death's door. It's their last resort. What percentage of patients do you feel like you've been able to help get well or help heal of the people that come to you in that state?
Well, it depends. Of course, we didn't have. I could say that also whether it's malignant melanoma end stage, whether it's end stage prostate, all the end stage patients, almost any form of cancer I can think of, we have, of course, not everybody, but many of them improve a lot, quality of life, they live years longer, but finally die. But that's a complete remission, and then it never comes back, with this one exception. I would say it is somewhere between 30 and 50%.
Yeah, it's remarkable considering how bad off these patients are when they come to
end stage. The immune system has been ruined by the chemo and the radiation and whatever they don't get. And I must say also MD Anderson in Texas, they also did 2 studies, to the best of my knowledge, with dendritic cells. Because why? I'm also in India, I'm a professor in New Delhi and so on and so on, where there was once a national day or a weekend, a national seminar, a congress for oncologists in India. And there were also 2 people from MD Anderson, because they were from Indian descent. And they came and they told the new studies. And I talked on 2 studies we had done, with good data, end-stage patients with dendritic cells. And they said, wow. So they did 2 studies, one in colon carcinoma, to the best of my knowledge, 15 years ago, and in breast cancer, and they had not, as we do, but they had pretty good results. Yeah, but it was never really published. It was once presented in a conference, but because you cannot patent it, because it's patients' own cells, and therefore it's also safe. I come originally also from the AIDS epidemic, and how many people got infected with HIV for blood products? Yeah, so blood transfusion or whatever, because if there are many viruses, and maybe also now we don't know or know yet, and therefore you can not screen for it, and that people can always, when you, it's also a box of Pandora if you get blood product on blood on donation.
Blood transfusions, or you're saying a lot of AIDS patients were giving blood and it contaminated the blood supply and people were getting AIDS, HIV via blood transfusions.
Yeah, also, I'm from now 12 years, I was the director for the Department of AIDS Epidemiology and Biostatistics at the University of California, San Francisco. So I'm also a biostatistician. And we had quite a few, and there's also in public health and so, that there were a certain percentage of people who, also babies, who got, for some reason, a blood product, and they had infected with HIV. I also worked in South Africa. That's a little bit other story than the United States. And there were many also children who were born and were infected because the mother was infected. So in the birth process, they got infected. Yeah, and so I know pretty much also of that. And now this is safe. You can't get it safer if it is actually your own blood donation. You give some of your monocytes, you get a week later your cells back, but they are then further somewhat trained to be dendritic cells. Yeah, and there is just no risk.
Yeah, there's no money in it because they can't be patented. They're using your own cells, cultivating your own cells, and then putting them back in your body. So I think the tragedy is, and again, one of the reasons I do what I do is to try to reach people and educate them before they get a cancer diagnosis, or catch them early in their diagnosis and encourage them to adopt a holistic approach to health, to incorporate nutrition and natural non-toxic therapies, and to really think hard and pray hard about conventional therapies, because they can be incredibly brutal and destructive and cause all this long-term damage that's irreversible and wreck your immune system, and in many cases make the cancer more aggressive and not cure you, right? And so it's much easier to get well if you adopt a holistic approach in the beginning than it is when you adopt it at the end stage of your disease after you've been completely brutalized.
Of course, and I fully agree, and therefore also you can use mistletoe as a prophylaxis. Yeah, or just vitamin D. That's a big study done in Germany, the German National Cancer Institute, and they did a large study in 300,000 people, and they found, it was published 2 years ago, they found when each Northern European would take 12.5 microgram of vitamin D3 per day as a food supplement, there would be in Germany 30,000 people less dying from cancer. 30,000. Think of the suffering and of the economic loss and so on. That would be for the United States, then something like 120,000 people would less die of cancer, plus minus one, of course, but there's a high association between the significant decrease of getting cancer and die from cancer and your level of vitamin D3. But yeah, vitamin D3, if you do that per day, it costs maybe $10 maximum. Yeah, now, that's all. I saw it happening. I've worked with the FDA and so on, and I saw it happening over the years. That medicine has become more and more a way to do business, and that is also, I suffer a lot from under this, because also I still nowadays, as far as I know, most countries it is not done. When I very much remember 1971 when I became a doctor, I had to give the pledge or the oath of Hippocrates. Yeah? And there the first sentence is, I will always fight for life and do no harm. So don't do harm. Yeah? And that is of course the issue with also chemo and radiation. Yeah? And how far also do you do harm? Yeah? And of course, a surgeon does also harm, but saves a life. You must cut open your belly and stop a bleeding, just say something. So it doesn't mean when cutting or so, but then there's a very significant chance that the patient will therefore be saved with his life.
I have been down the vitamin D3 rabbit hole, and I take vitamin D3. I think it is one of the most important vitamin supplements you can take, the number one anti-cancer vitamin. I'm so glad you brought that up, and we'll put a link to that study. I'm going to ask you to send that study to my team, and we'll link to that.
Yeah.
So people can see that. But yeah, vitamin D3, is an incredible vitamin and hormone for your immune system, correct?
Also for viral infections, for this, that is, and of course, as an anthroposophical doctor, I also understand where it comes from, and therefore, and that means also sunlight. And therefore, in Northern Europe, people have less sunlight because, something in Northern Europe, for 1 or 2 months, the sun doesn't even rise. It's day and night. It's night. Yeah. So then you have, the consequence, no production of vitamin D3. You need to have at least 45 minutes or 1 hour when you are pale like we, to have a sun exposure for ultraviolet light. And so anyway, so you can also do a lot of prophylaxis, and so that's also why we pay attention to our cancer patients. But of course, it is most remarkable that when we have patients really dying, well, so one patient was a professor in Vancouver. He wrote a book about his own recovery, and he was such poor condition that even Air Canada didn't want to fly him over. So he went through some kind of Air Bulgaria. So anyway, but and he's also now 12 or 13 years completely free of cancer. He's now 86. And of course, nobody had ever expected he would do that. And he also wrote in a book about it, and the title is "I Did It My Way." So first did the chemo and the hormones, and the hormones gave him a few months of response, but then it disappeared, and so anyway. So I think what I like to say to you and to patients and colleagues, we do immune restoration, because often when you get cancer when you're 55, your immune system did well for 50 years, so to speak. Yeah. So it's not that you never get cancer over a weekend.
Immune restoration, that is the key. So can we talk about cannabinoids?
Yeah. Okay. Now, I had my first coming from Amsterdam. So maybe very briefly, in the Netherlands, cannabis was actually never forbidden or
It's never illegal.
Yeah, never illegal. Maybe not legal because the European Union, but it was sort of. I even saw a policeman once in a traffic with a thick joint in his mouth, doing regulating what the traffic lights fell out. Anyway, so what the Dutch always said, because in the Netherlands, a small country, you can cross the whole country in 1 hour by car. But the statistics was at that time in the 60s that about 18,000 people died per year because of alcohol consumption, heart disease, liver, accidents. And they said how many people, cannabis was maybe not as much used as alcohol, but also a lot of people do that or have space cake. And there was never ever documented somebody who died from cannabis. So then the logic was, well, if any supermarket I can get beer and wine, then why can't I get my joints in the supermarket? So now, and there was a compromise made. So, and therefore also all the studies we did, so there's essentially no lethal dose of especially THC and for sure not CBD. Now, there are now, I know, hundreds of studies showing that CBD, that's why we used it since the year 2000, that special CBD, that is a COX-2 inhibitor. Now, what's a COX-2 enzyme system? When you have an infection, you make maybe fever and reaction, and when your immune system is able to overcome it, you heal, and that's basta. But if your immune system cannot really overcome it, then you get a more chronic chronic inflammation, and that causes, on the long run, cancer. Yeah, that's why you have hepatitis B virus, you can have primary liver cancer, and so on. And also, women with cervix carcinoma, they always were usually infected with human papilloma virus, and about 98% of all women, they can clear it. It might take a few weeks, but they clear it. But about 2% to 3%, their immune system cannot really eradicate it. And then you get a chronic inflammatory reaction, and then you get an abnormal pap smear. So, and then you see sort of cells, not normal, not completely abnormal, so halfway. So, and now also the mistletoe is remarkable, also in prophylaxis, but also about the fact that it becomes a chronic, and there's always a chronic destructive CB, and that is a COX-2 enzyme sort of system, a vicious circle. And you can stop that with CBD. And CBD costs nothing. It's non-toxic, not addictive.
So you're saying CBD as a COX-2 enzyme inhibitor can stop this cycle of chronic infection that can be caused by
chronic inflammation.
Chronic inflammation caused by infection.
Yeah. And usually by viral infection, but also even other chronic inflammatory reactions. So to works also, you have arthritis, chronic arthritis, or this or that. It is actually, and even the FDA 2 years ago, it approved it
for certain forms of epilepsy. Yeah, you have certain children with epilepsy, and that is so horrible and so destructive for the brain that most of them don't even reach puberty or adolescence. And the classical anti-epileptic medication doesn't do much. So, but CBD does miracles. Then as soon as they start taking that orally in a capsule, then actually they can live a normal life and normally develop the CBD. Yeah. So I did studies then in AIDS and cancer patients in the 1980s in San Francisco, and it was even a license by the Food and Drug Administration, but on a prescription. For instance, also in pain, but also in loss of appetite, and when you lose weight, that is an independent risk factor for morbidity and mortality, as we say, you die earlier, and so on and so on. So there was really we only found positive things about CBD, but also and this is a little bit the issue. Why do many Americans think that cannabis is bad and makes you cuckoo and so? Just the following. About 1% in the West, 1% of the whole population is schizophrenic. And when does schizophrenia sort of really surface? When you start your puberty. But it is so, you hear maybe voices, you still a feeling, oh, somebody is standing behind me or I'm watched or so. And then often the two reasons, and I'm also a school doctor, you must always remember, young adolescents who sort of are fearful, they see things, hear things that the first thing is not there. And there are two self-medication, that is alcohol or cannabis. So they discover, they know alcohol, they feel much better, and with cannabis for sure. And then they start taking that as a self-medication. Yeah, and then until they're maybe in the 18 or 19 and so, and then it's not enough, and then they break through. And then what happens? Sometimes when a teenager was caught with a joint or so, they had to go to the police station and maybe stay there overnight. Yeah, and then he was without his self-medication. And then there was that somebody, one of those special 2 days, then they started to act funny, but it was because they didn't get their medication anymore. And now it's 100 times proof that certain cannabinoids have a strong antipsychotic effect. So, but the conclusion was in those days, guck mal, we picked them up, and then the next day they are schizophrenic. They have the first symptoms of being schizophrenic, but it was because they couldn't get the self-medication. And the same with alcohol. So any teenager with alcohol problems, you must always think, as a teacher, but for sure as a school doctor, this could well be as a self-medication for the early symptoms of schizophrenia.
That's really interesting. And back, in those early days of fear mongering, reefer madness, and whatnot, they were jumping to conclusions or drawing correlations that people who were suffering from some type of mild mental illness, whether it was schizophrenia or just anxiety, right, PTSD, all these difficult mental and emotional challenges that people have, then those people were gravitating towards alcohol and drugs as self-medication, but the alcohol and drugs, or marijuana, for example, was blamed for causing their problem. That's what you're saying.
Exactly. Now, nobody will claim that alcohol makes you schizophrenic because everybody drinks alcohol. Yeah, but the cannabis, it was easy, but that was a whole other story. I also sort of writing a book on this. How come that for thousands of years, cannabis was the most commonly medication prescribed? Or that is a prince of the cannabis plant for the period of the Yellow Emperor. And so that was sort of about 2,000 years ago. And they were all, Hildegard von Bingen, so eine highlight in the Middle Ages in Europe. And they were always very positive about the cannabis, what it did. And many of our clinical studies, so dysmenorrhea, so women with menstruation cramps or this or that, it is an asthma, and so it works remarkably. So therefore, and also almost all the pain clinics in German and Dutch universities, when patients come for chronic pain or pain treatment, they also get included CBD.
It seems like the research is starting to, really get a clear understanding of CBD, but it seems to be much more beneficial in the body than THC. Would you agree with that?
Yeah, I fully agree with that. And also, we know you have an endorphin system in your body that you make morphine-like substances yourself. And the same is with cannabis. You have also endocannabinoids. They're well described. So anandamide was the first one, and so so also there was a Professor Mechulam who recently died in Jerusalem, and he also was a front runner in sort of rehabilitating the cannabinoids, and I think he did a great job. And I think, you can never say he did something wrong, but he also showed the medical benefits from various cannabinoids. I did specimen studies at UCSF, the CBD, and in the THC. That was the name, the dronabinol, but the THC, and that also what often is forgotten, all these studies doing cancer patients, the quality of life. Because when you get chemotherapy, you get your peripheral neuropathy and your blood transfusions and your nausea and so. But it's not. They only say, well, you live 6 months longer or so. That's the outcome. But the price you have to pay that. Now, if you give just a little bit of cannabis in addition, the people will have no nausea. They have appetite. This and that. Of 90%. There is really actually in Europe the cannabis, especially in Holland, it was quickly recovered and recognized as many beneficial treatments. I did a study with the Department of Neurology in the University of Amsterdam, and we looked in MS patients with significant symptoms and cannabis. And they did remarkably better and live much longer. So the average multiple sclerosis, so MS patient in the Netherlands, 90% takes cannabis. Even on prescription, even though the insurance company pays for it.
Well, the good thing now is that in the U.S., it is very easy to get CBD. And I know there's a lot of different products and varying levels of quality. But it's not hard to get it now.
Well, yeah, then people should move to Holland. I'm not joking. As I say,
Dr. Gorder, we're almost up at a full hour here. This has really flown by fast. Do you want to take a minute to explain the Gorder Model, what the Gorder Model is that you developed?
Okay, because we also have a website, but the Gorter Model, in principle, is so that we always say there's a non-toxic approach. Okay? So we do use actually exclusively what is non-toxic. Because also with the idea behind it, when something is toxic for you, it's actually not good for you.
So, yeah, that's a wild idea right there.
Yeah, but it's still, and I'm a professor at university, blah, blah, blah. So I can say that, I can dare to say that. But it is so, if something is toxic, especially if you have a few hours, maybe payment and so on, okay. But when it's toxic, it's not good for you. Yeah, and if you look at modern cancer therapy, which already started, there's a whole other issue, maybe we can talk about it once. That is from Rudolf Virchow in 1848. He made a postulation, and still modern oncology is still based on the postulation of Rudolf Virchow from 1848. Yeah, so almost 200 years. We said, must kill cancer cells. No, cancer cells are normally killed in each person if the immune system functions well. Anyway, so but the Gorter Model, we do anything which is what we know, experience, but usually also because of science, the studies we do the cells of others, which is beneficial actually for anybody, especially now today, but for sure people who have cancer of the rhesus, suppressed killer cell function, not enough DNA repair, blah, 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 and then we can show and prove, but also other researchers independent from us, they found exactly the same. Now, what do you want more than in modern medicine? That somebody has well-documented efficacy and somebody else finds the same.
I love that. I love the fact that taking a non-toxic approach to medicine and health and patient treatment is central to what you do, because there aren't enough doctors in the world that think that way. Although I do think things are changing. I think I'm seeing positive progress.
I agree, but that's why I really appreciate and love to be your guest, because there should be more known, not only to patients but also to medical doctors. And so many colleagues I meet who have no idea. Yeah, and also, well, you should have been more awake as a medical student. So, but for instance, what I do also, what I really love, I'm also acupuncturist. I even have done many big abdominal operations with acupuncture anesthesia and so on. Was also in 1981 also in China, but also what I also do is antiphospholic medications, which are essentially homeopathic medication. I inject them at an acupuncture spot. So what the acupuncturist would do, okay, but I give them a big extra jolt if I add to that and also a few drops of an antiphospholic medication. And that's all what I developed. And I would love that there would be more doctors, young doctors, so anybody can come, and that we do more research and that they also teach it. But the patient always is front. And essentially, I always say, if something has side effects, then it's harmful.
Where can people find you? How can they connect with you?
Well, of course, we have there's a website, but I will update that if you want now after our discussion, where they can ask for more information. That is an email address, info@gordermodel.org. Because especially what I do, I never ask for any, maybe a cup of coffee, or when I go somewhere, maybe €50 for my gasoline ticket or so. But and I like to do that, but they can, and I always respond. But also here now, I'm right now in San Francisco, where I do that already since 1984. Twice a year, I give a very official class in all of this and much more in anthroposophical health study since 1984 at San Francisco State University. And so that's also why I'm here again, and we do that twice a year, an official class. But we want to beef it up a little bit and make eventually an endowed chair for that. And of course,
so twice a year you teach a class on many of these things at San Francisco State.
Yeah, exactly.
That's great. And so people can, we'll put a link to your website. People can connect with you and find out more about the class you teach and connect with you personally. Thank you, Dr. Robert Gorder. This has been absolutely informative and fascinating. And thank you for sharing this information on mistletoe, dendritic cells, cannabinoids, hypothermia. I mean, these are treatments that are available. They're not available in every city in the United States, but there are practitioners that do use them, and you have to ask, right? You have to ask about them. They are more readily available in clinics outside the U.S. There's definitely clinics in Mexico and Germany where you can get these therapies. And if folks connect with you, I'm sure you might have some recommended clinics in the U.S. that people could inquire as well. So again, thank you for your time. This has been absolutely fantastic. I hope you have a great day.
Well, you make me shy, but thank you. I will tell it to all my whole team because I don't do it alone. I have a whole team of people and so. But I'm one of them. Okay.
Thanks for watching, everybody.
Thank you. Thank you. Bye-bye. Bye-bye.